Have you ever found yourself wondering, quietly and without telling anyone, whether masturbation is still healthy after the age of 50, 60, or even 70? Have you ever worried that something so personal could be harming your prostate, weakening your body, or affecting your health in ways no one has explained? If those thoughts have crossed your mind, I want you to know something important. You are far from alone. This is one of the most common questions older men think about, yet very few ever feel comfortable asking. Unfortunately, that silence has allowed myths, fear, and misinformation to spread for years. Some people insist masturbation becomes dangerous as men grow older. Others claim it's something every man should do regularly. The reality is much more balanced than either of those opinions. Today, we're going to replace confusion with medical facts. I'm Dr. Rose. As a practicing urologist, I've spent years helping men protect not only their prostate and urinary health, but also their confidence, independence, and overall quality of life. Throughout my career, I've spoken with thousands of men who ask these same questions in private because they felt embarrassed or afraid of being judged. That is exactly why I wanted to make this conversation available to everyone. In today's video, we'll carefully explore 10 evidence-based benefits masturbation may provide for older men. Just as importantly, we'll also discuss 10 common mistakes and health risks that many people never hear about. One of those risks surprises almost every patient I speak with. Understanding it could help you protect your prostate, preserve your sexual function, and support your health for many years ahead. Before we begin, I'd really appreciate your support. Please take a second to press the like button. Doing that tells YouTube this educational discussion deserves to reach more people who may be searching for honest medical information. I'd also love for you to leave a comment telling me where you're watching from. It's always encouraging to see men from different countries coming together to learn, support one another, and have conversations that too often remain hidden. And if you're interested in practical, science-based health advice designed especially for men over 50, don't forget to subscribe so you never miss future videos. Now, let's begin with something that often surprises people. The simple truth is that masturbation, by itself, does not damage your body. It does not automatically weaken your masculinity. It does not shorten your lifespan, and it certainly does not guarantee problems with your prostate. For many older men, when practiced mindfully and in moderation, it can actually become part of a healthy lifestyle. The real question isn't whether you masturbate. The real question is how you do it, how frequently you do it, and whether the habit is supporting your health or quietly working against it. That distinction is where many misunderstandings begin. Once you understand that difference, everything becomes much clearer. Rather than relying on rumors or outdated beliefs, it's important to look at what modern medical research has discovered. This conversation isn't based on myths, personal opinions, or the uncomfortable jokes many people grew up hearing. It's based on decades of research in urology, endocrinology, psychology, and men's health. Large clinical studies have examined how sexual activity affects the aging male body. Research from respected institutions, including studies focused on prostate health, hormone balance, circulation, and mental well-being, has given us valuable answers. Doctors who care for men in their 60s, 70s, and beyond continue seeing the same patterns in clinical practice. The evidence consistently shows that masturbation has meaningful benefits. At the same time, it also carries certain risks when practiced carelessly or excessively. Understanding both sides allows you to make informed choices instead of emotional ones. Think of it as any other health habit. When done correctly, it can support your body. When done without awareness, it can gradually create problems. That's why today, we're looking at the complete picture. Let's begin with the very first benefit. One of the most important advantages is maintaining healthy penile tissue. Many people don't realize that erections actually serve an important biological purpose beyond sexual activity. You can think of an erection almost like exercise for an essential part of the body. Whenever blood flows into the erectile chambers of the penis, known medically as the corpora cavernosa, those tissues receive fresh oxygen and nutrients. This circulation helps keep the tissue flexible, healthy, and responsive. Without regular blood flow over long periods, those tissues may gradually become less elastic. As time passes, firmness can become more difficult to achieve. For many older men, regular erections through masturbation can help maintain healthy circulation and support the normal function of these tissues. Now let's move to the second major benefit, which is prostate health. This is one of the areas that has received considerable scientific attention over the years. Several well-known studies have suggested that regular ejaculation helps clear accumulated prostatic fluid. By emptying these secretions, the prostate may reduce the buildup of inflammatory substances, damaged cells, and other waste materials. Researchers have even observed associations between regular ejaculation and a lower likelihood of certain prostate problems later in life. While masturbation is certainly not a cure or guarantee against disease, it may become one healthy piece of an overall lifestyle that supports long-term prostate function. That is one reason many urologists encourage patients to look at sexual health as part of overall wellness instead of treating it as something separate or embarrassing. The third benefit is one that many men rarely think about, yet it plays an essential role in maintaining independence as they grow older. Every orgasm activates a group of muscles located deep within the pelvis. These muscles contract in a natural rhythm, strengthening an area known as the pelvic floor. One of the key muscles involved is the pubococcygeus muscle, which helps support both urinary and sexual function. When these muscles remain strong, men often experience better bladder control. They may also notice improved erectile function and greater confidence during intimacy. A healthy pelvic floor can even reduce the likelihood of urinary leakage later in life. Just like exercising your legs or your back, these muscles benefit from regular activity. The fourth benefit involves something that affects nearly every part of the body: stress. Modern life places enormous pressure on both the mind and the body. As stress builds, your body releases cortisol, often called the stress hormone. High cortisol levels are associated with elevated blood pressure, increased anxiety, poor sleep, and even a greater strain on the heart. Following orgasm, cortisol levels naturally begin to decrease. At the same time, your nervous system shifts into a calmer, more relaxed state. For many men, this creates a noticeable sense of relief after a difficult or demanding day. While masturbation should never become your only method of managing stress, it can certainly be one healthy tool within a balanced lifestyle. Benefit number 5 focuses on your brain. Many people think sexual activity only affects the body. In reality, some of the most important changes happen inside the brain itself. Following orgasm, several powerful neurotransmitters are released. Among them are dopamine, oxytocin, and endorphins. Each one contributes to emotional well-being in different ways. Dopamine supports motivation and feelings of reward. Oxytocin encourages relaxation and emotional comfort. Endorphins act as the body's natural pain relievers while also improving mood. Together, these chemicals explain why many men feel calmer, happier, and more emotionally balanced afterward. As men grow older, maintaining emotional health becomes just as important as protecting physical health. These natural chemical responses may help reduce feelings of loneliness, low mood, or decreased motivation that sometimes accompany aging. Benefit number 6 is one of the most practical advantages, and it has very little to do with pleasure. Regular self-examination increases body awareness. When you become familiar with your own anatomy, you quickly learn what feels normal. That makes it much easier to notice changes if they occur. Many men first discover testicular lumps, unusual swelling, penile curvature associated with Peyronie's disease, or other abnormalities while examining themselves during masturbation. Finding these changes early allows treatment to begin sooner. In medicine, early detection often leads to better outcomes. Sometimes noticing a small change at the right moment can make an enormous difference months or even years later. Benefit number 7 is especially valuable for men who struggle with poor sleep. Many older adults find themselves waking frequently during the night or having difficulty falling asleep. Hormonal changes, stress, medications, and aging itself can all contribute to insomnia. After orgasm, the body naturally produces hormones, including prolactin and oxytocin. These hormones help relax both the body and the mind. Heart rate slows, muscles become less tense. The nervous system shifts into a more restful state. For many men, this creates ideal conditions for deeper, more restorative sleep. Although it isn't a replacement for healthy sleep habits, it can become another useful part of an overall bedtime routine. Benefit number 8 involves circulation throughout the pelvic region. Most people understand that erections require healthy blood flow. What they often don't realize is that improved circulation benefits much more than the penis alone. Healthy blood flow also supports the prostate, bladder, surrounding muscles, connective tissues, and nearby nerves. Poor circulation may contribute to stagnation within these tissues. Over time, that stagnation can worsen urinary symptoms and reduce overall pelvic health. Maintaining healthy circulation helps nourish these structures and supports their normal function. Think of it as keeping an important system active rather than allowing it to become sluggish over time. Benefit number 9 is especially meaningful for men who want greater confidence in intimate relationships. Masturbation provides an opportunity to better understand your own body's responses. Techniques such as the stop-start method allow men to practice recognizing the point of climax before ejaculation occurs. With patience and consistency, this awareness may improve ejaculatory control. For men dealing with premature ejaculation, practicing these techniques privately can later translate into improved confidence with a partner. It's not simply about delaying ejaculation. It's about learning greater awareness, control, and communication with your own body. Finally, benefit number 10 reminds us that the brain remains the most important sexual organ we possess. Healthy sexual function begins long before any physical response occurs. Desire starts within the brain itself. When healthy sexual thoughts, imagination, and stimulation continue throughout life, the neural pathways responsible for desire remain active. Just like muscles that weaken when they aren't used, certain brain pathways can also become less responsive over time. Maintaining healthy sexual activity may help preserve libido and support the brain's natural ability to respond to intimacy. Many experts describe this as avoiding the use it or lose it effect that can gradually occur with aging. So, as you can see, the scientific evidence presents many positive reasons why masturbation can support healthy aging when practiced responsibly. However, every healthy habit has another side. Even something beneficial can become harmful if it's approached carelessly or taken to extremes. That's exactly why it's equally important to understand the mistakes that can quietly undermine these benefits. Now that we've explored the advantages, it's time to discuss the risks every older man should recognize before making masturbation part of his long-term health routine. Let's continue with risk number 8, because this is an area where many men assume that more is always better. The truth is, your body functions best when there is balance. Just as ejaculating too infrequently may allow prostatic secretions to build up, ejaculating excessively over long periods can also place unnecessary stress on the pelvic region. Some men who masturbate several times every single day eventually begin noticing a dull ache in the pelvis. Others describe a feeling of heaviness around the prostate or unusual fatigue afterward. These symptoms are your body's way of asking you to slow down. Ignoring them won't make them disappear. Instead, Pay attention to what your body is telling you. Every man is different. There isn't one perfect number that applies to everyone. The healthiest approach is moderation. If your body feels comfortable, energized, and free from discomfort, you're probably within a healthy range. If you begin experiencing soreness, exhaustion, or persistent aching, it may be time to reduce the frequency and allow your body adequate time to recover. Listening to your body is always wiser than following rigid rules. Now let's look at risk number 9, reduced semen quality. For most men over the age of 60, having children is no longer part of their future plans. However, for those who are still trying to conceive, ejaculation frequency becomes much more important. Sperm production is a continuous process. Your body is always creating new sperm cells. But if ejaculation happens too frequently, sperm concentration may temporarily decrease. That doesn't necessarily mean infertility. It simply means the semen may contain fewer sperm than it otherwise would. Research suggests that when fertility is the goal, allowing approximately 2 to 5 days between ejaculations often provides a healthier balance for sperm concentration and overall semen quality. Again, this recommendation doesn't apply equally to every individual. Age, hormone levels, lifestyle, medications, and underlying health conditions all influence fertility. If conception is an important goal, discussing your specific situation with a fertility specialist or urologist is always the best approach. Now we come to the 10th and final risk. This one has become increasingly common over the past decade because of easy access to online pornography. The concern isn't simply pornography itself. The concern is how excessive exposure affects the brain. Modern internet pornography often provides endless novelty, unrealistic scenarios, and constant visual stimulation. Over time, the brain may begin adapting to these unusually intense levels of stimulation. As that happens, real-life intimacy may no longer feel as exciting by comparison. Some men notice they become less interested in genuine relationships. Others find it more difficult to become aroused without viewing explicit material. This isn't because their bodies are failing. It's because the brain has gradually adjusted its expectations. Healthy intimacy involves much more than visual stimulation. It includes emotional connection, communication, affection, trust, shared experiences. If pornography becomes the primary source of sexual stimulation, those important aspects of intimacy may slowly lose their influence. If you choose to watch pornography occasionally, try to maintain a healthy balance. Don't allow it to replace imagination. Don't allow it to replace emotional closeness. And most importantly, don't allow it to replace real human connection. Your brain benefits when fantasy, memory, affection, and genuine intimacy all work together rather than relying on only one source of stimulation. So after looking at both the benefits and the risks, what should you remember most from today's discussion? The answer is actually very simple. Masturbation after the age of 60 is neither automatically good nor automatically bad. Like many other aspects of health, it's simply a tool. When practiced consciously, responsibly, and in moderation, it may support prostate health. It may help maintain erectile function. It may reduce stress, improve sleep, support circulation, and contribute to overall well-being. On the other hand, when it becomes excessive, emotionally unhealthy, physically careless, or disconnected from real life, those same benefits can gradually disappear. Instead of helping you, the habit may begin working against your long-term health. That's why awareness matters so much. Healthy habits aren't defined by extremes. They're defined by balance, consistency, and good judgment. Rather than asking whether masturbation is good or bad, a much better question is this: is the way I'm practicing it improving my health? Or is it quietly creating problems that I haven't recognized yet? That simple question can guide far better decisions than any myth or opinion ever could. So, What do I personally recommend as a practical starting point for most healthy men? First, aim for moderation rather than extremes. For many men over the age of 50, masturbating around 2 to 4 times each week falls within a comfortable and healthy range. Of course, every individual is different. Your overall health, medications, hormone levels, and lifestyle all play a role. That's why it's always better to pay attention to how your own body responds instead of comparing yourself to someone else. Second, don't overlook the importance of proper lubrication. Using a good quality water-based lubricant helps reduce unnecessary friction and protects the delicate skin of the penis. It also makes the experience more comfortable while lowering the chance of irritation or small skin injuries. Another helpful habit is varying your technique from time to time. This reduces the likelihood of becoming overly dependent on one specific form of stimulation and helps maintain healthy sensitivity over the years. Most importantly, stay aware of what your body is telling you. If you notice persistent pain, numbness, swelling, changes in erections, blood in your urine or semen, or any unusual symptoms that continue, don't simply ignore them. Your body communicates through symptoms. Those signals deserve attention, not embarrassment. Seeking medical advice early often makes treatment much easier and far more effective. Above everything else, remember that masturbation should enhance your quality of life. It should never become something that replaces meaningful relationships, physical activity, emotional connection, or other healthy habits that keep both your body and mind strong. Balance is what truly protects your health. I also understand that this topic can feel deeply personal. For many older men, this may be the first honest conversation they've ever heard about masturbation without judgment or shame. If that's true for you, I want to reassure you of something. There is absolutely nothing wrong with taking care of your body in a healthy, responsible, and informed way. Sexual health is an important part of overall health. It deserves the same level of attention as heart health, prostate health, nutrition, exercise, and sleep. Unfortunately, many men spent decades believing they should never ask these questions. They stayed silent because they feared criticism or embarrassment. But silence doesn't protect your health. Knowledge does. The more accurately you understand your body, the better decisions you can make throughout your life. You don't need to feel guilty. You don't need to believe you're too old. And you certainly don't need to accept discomfort or confusion simply because you're getting older. Age does not mean the end of vitality. In many ways, it simply means becoming wiser about how